Thank you so much for joining us this evening. As per usual, this is the NIO webinar at the start of the flu vaccination campaign for this season, 2022-2023. And thank you so much for joining us this evening. So eventually, our Director of Public Health, Dr. Lucy Jessup, will also be joining us. But I'd like to introduce the panelists here with us who'll be taking us through the webinar. So my name is Dr. Aparna Keegan, and I'm one of the specialists in public health medicine, and I'm also the clinical lead for the flu vaccination program in the NIO. Next to me, we've got Mutu Saba, who will introduce himself. Mutu, do you want to go ahead?
Hi, good evening. This is Muthu Sabha. I'm working as an Assistant Director of Nursing add-on at the NIO. Thank you.
Thank you, Mutu. Next, we've got Dr. Alice Quinn. Alice, do you want to introduce yourself?
Hi there. I'm a Senior Medical Officer at the NIO.
Thanks, Alice. Kriya, do you want to introduce yourself?
Hi there, my name is Kriya Dowling. I'm a Communications Officer at the NIO and I'm supporting a parent on the comms campaign for flu this year.
Thank you very much, Kriya. And we've also got Yvonne Morrissey, who's our Communications Manager within the NIO, who's working away in the background, supporting us on this. So next slide, please. So Lucy will be joining us in shortly. I think she's having a couple of issues getting into the webinar. Just before we start, I just wanted to let everyone know that we're also recording the webinar because I know that not everyone would be able to come in today. So this will be available on our immunisation.ie website, so you can look back on it if need be. But today we've got a quite heavy agenda that we'll be going through in the next hour or so. So we'll be starting off with the introductions, looking at the impact of the flu activity. We'll also be talking about the flu vaccines that will be available this season. We'll be looking at the recommended groups for the flu vaccine, who's included and who's not. We'll be talking a little bit about the COVID-19 vaccines and what that means for the flu vaccination program. A little bit about the changes to the ICT system and the resources available for vaccinators, and addressing some of the common questions that we receive on our immunisation inbox that our clinicians reply to, and also just a quick Q&A as well. Yvonne will be writing some things in the chat as well, so keep an eye out for that, and you'll be able to ask us any questions in the chat box. And the panelists who are here who are not talking will also be attempting to answer some of those questions, and we'll also try and get to them at the end of the session as well. Next slide, please. So just a little bit in terms of the effects of influenza. So just so that people know a bit of the background about flu, really. So flu may be asymptomatic in up to 3/4 of cases, but flu outbreaks can cause significant morbidity and mortality as well. And flu tends to be more severe in the elderly, those with chronic heart or lung conditions, younger children, particularly under the age of 4, those with cerebral palsy, and also in pregnant women as well. And in particular in the elderly, 80 to 90% of flu-related deaths occur in the older adults, particularly due to the secondary bacterial pneumonia, but also exacerbation of underlying health conditions such as COPD or heart disease. Next slide, please. So just to mention, I know we've had in terms of when the pandemic started, because of the restrictions, we didn't have much of a flu season then. But in the previous years, for example, in the 2017-2018 season, flu can have a really significant impact, and that season was particularly bad. And in that season, what we saw was, the consultations in the GP, particularly our Sentinel GP network for influenza-like illness, the consultation rates were higher than in the previous 5 seasons. We had under 5,000 cases of hospitalization. Unfortunately, 191 people were admitted to critical care units, and admissions, particularly in the elderly, was really high as well. And sadly, there were also 255 deaths notified during that season as well. And there was also a significant impact in terms of the number of outbreaks that were reported, which is around 225. So it's just really important knowing that actually, although in the previous couple of seasons we may not have had a bad flu season, it doesn't mean that the risk isn't still there. So next slide, please. So flu activity. So I mentioned a little bit about the fact that there was no flu circulating in Ireland during the 2020-2021 season due to the public health restrictions in place because of COVID. But flu activity did return last season during the 21-22 season. So in that season, there was about just over 2,000 cases of flu that were reported, that were confirmed. 520 people were admitted into hospital, and there were 15 people admitted into critical care as well. And across Europe, there was also widespread flu activity last season, and flu activity is expected to continue this season, particularly because flu, society is much more open, so it is expected to circulate this flu season as well. Next slide, please. I know there's been lots in the media about the Australia's flu season, so just wanted to bring that up because I know we get quite a few questions about what that means for us. So Australia did have an earlier flu season than expected, and in the early part until mid-July, actually, the number of notifications exceeded the 5-year average. And there were a number of admissions to hospital, and also in terms 6.5% were admitted directly to ICU as well. The age cohort that was particularly affected was those children under the age of 19. And those were coincidentally the children that were not vaccinated. Their vaccination rates at the start of the flu season was around 10%. And it increased during the flu season because they made a concerted effort, because they saw such a high rise in the children's cases. They made a concerted effort to improve vaccination rates there. However, their surveillance report does state that the impact for the season to date is low to moderate. So it was an earlier flu season than expected, but the public health impact has been low to moderate. And our surveillance scientists and the HBSC do advise caution when comparing Australian data to previous season, because there has been changes to testing and surveillance. So maybe those testing and surveillance changes means that we're picking up more flu rather than there being more flu in Australia at the moment. Next slide, please. But I think there are lessons to be learned from Australia, though. So it's one lesson I think that's key to think about is that we are expecting flu activity to be there this season. And also it'll be really important that we improve vaccination rates, particularly in children before, the flu outbreaks begin. And also the latest WHO surveillance report states that, they recommend that countries are recommended to prepare for a co-circulation of flu and COVID-19 this winter, and to really step up our vaccination campaigns for both vaccination campaigns to make sure that we're protecting our health and care system for everyone this winter. And as always, the NIO messages, vaccination remains the best protective measure that you can do for prevention of flu this winter. Next slide, please. So I'll move on to talking about the flu vaccines that are available this flu season. So for the 2022-2023 flu season, there are 3 flu vaccines that are available, which are 2 types. So there's the Qiv vaccines, which is the quadrivalent influenza vaccines, and there are 2 types of those. And that's the quadrivalent influenza vaccine manufactured by Sanofi Pasteur, and also Influenza Tetra manufactured by Mylan. So both of these are actually licensed from the age of 6 months and above, but we tend to use them for adults aged 18 and over with underlying health conditions, adults aged 65 and over, pregnant women, healthcare workers. There's also some children, for example, aged between 6 months to under 2 years, who may have an underlying health condition, who may also require this vaccine as well. So the Qiv vaccines that we have this year are injectable flu vaccines. So they're given intramuscularly, and I'll go through a little bit more in detail. And also the shelf life for these 2 vaccines is 1 year, or until the end of the flu season. But it's really important that you look at the expiry date on the vaccine when you get it. The second type of flu vaccine that we have, the brand is called Fluence Tetra, and this is the live attenuated influenza vaccine, and it's a nasal spray suspension. So it's given as a nasal spray, and it's only licensed for children aged 2 to 17 years old, and it's manufactured by AstraZeneca. And it's really important to note that the shelf life for this vaccine is only 18 weeks from manufacturing. So actually, when you get it into your GP, pharmacies, or vaccination sites, it's really important that you vaccinate children as soon as possible, but also that you're checking the expiry date on the vaccine, because it could be quite short. Next slide, please. So this is just a picture of the presentation of the boxes that come in so that you're familiar with the various vaccines that are available this flu season. So on the left-hand side, you've got the quadrivalent influenza vaccine, split viral inactivated, that's manufactured by Sanofi Pasteur. That's our QIV. And also we've got the next QIV, which is the Influenza Tetra, which is produced by Mylan, which is a new flu vaccine for this season, but it's interchangeable with the one that's produced by Sanofi. So both those QIV vaccines, they're called QIV vaccines, and they can be used interchangeably. If 2 doses are required, it doesn't matter if you use the Sanofi one for the first one, and the Mylan one for the second one. So they can be used interchangeably. And when you order the flu vaccine, you're not actually able to select the brand. You're just able to order the quadrivalent influenza vaccine. So you'll be getting that. And then on the extreme right-hand side, you've got the Fluence Tetra, which is our nasal flu vaccine for children aged 2 to 17. So just to mention as well, you may notice that the adjuvanted QIV, which was available last year, Fluad Tetra, is no longer available this flu season. So for older adults aged 65 and over, you can use either of those flu vaccines you can see there on the slide now, which is the one produced by Sanofi or the one produced by Mylan. So going a little bit more into the dose and administration of the QIV vaccine, so either of those on the right, they're only licensed for those aged 6 months and over. It comes in a box set, pre-filled syringes, as many of you will be aware, and it comes in boxes of 10. So the vaccine should be allowed to reach the room temperature before use. You should shake before use and inspect it prior to administration. And the reason why you're inspecting it is that the vaccine shouldn't be used if there's foreign particles that are there in the suspension. The vaccine, after shaking gently, is a colorless liquid, and the dose is 0.5 mils. And it's given by intramuscular injection into the anterior lateral thigh for younger children under 3 years, or into the deltoid muscle for those aged 36 months onwards. Next slide, please. So just to go into the dose of the quadrivalent influenza vaccine, so the QIV, it's usually 1 dose. In certain rare circumstances, you may need to give 2 doses. For example, for children aged 6 months to under 9 years who get this vaccine, they should be given 2 doses 4 weeks apart if they're receiving the flu vaccine for the first time, or you don't know if they've had a flu vaccine before, so unknown vaccination history. Patients post-hematopoietic stem cell transplant or post-solid organ transplant also require 2 doses 4 weeks apart if they're receiving the flu vaccine for the first time post-transplant. The last group is cancer patients who received the flu vaccine while on chemotherapy or who complete their treatment in the same season require 2 doses, with a second dose at least 4 weeks after completion of chemotherapy and at least 4 weeks after the first dose. So that's just a bit of a quick summary of the doses that are required. But as I said, most people only require 1 dose per flu season of the QIV injectable flu vaccine. Next slide, please. So just a bit in terms of the contraindications, and most of you will hopefully be familiar with the previous seasons. So as per most vaccines, the QIV is contraindicated in those with an anaphylaxis following a previous dose of an influenza vaccine or any of its constituents. You should look at the summary of product characteristics or the SMPC to see a full list of the vaccine-specific ingredients. The second contraindication is those with severe neutropenia shouldn't receive any vaccines to avoid acute vaccine-related febrile illness. However, the exclusion for that is those with primary autoimmune neutropenia who can get the flu vaccine, unless, of course, there are other contraindications there. The last contraindication for the QIV vaccines is patients on combination checkpoint inhibitors shouldn't receive any flu vaccine because of the potential association with immune-related adverse reactions. Next slide, please. We also have some precautions associated with the QIV vaccine. For example, if there's an acute severe febrile illness, you should defer vaccination until recovery. And also, if the flu vaccine is recommended in children aged 12 to 23 months, it should be separated with the PCV vaccine by at least 1 week. This is just due to the slightly increased risk of febrile convulsions if those two vaccines are given at the same time in this age group. Another common question we always get is around egg allergies, and it's really important to remember that actually those with a confirmed egg allergy or egg anaphylaxis can be given the flu vaccine in a primary care or a school setting, and the only exception to that is those who required admission to ICU for a previous severe anaphylaxis to egg. And those who did have that, small exception, who did have admission to ICU due to a severe anaphylaxis to egg, they should be referred to a specialist assessment with regards to vaccine administration in a hospital. Next slide, please. I'll be going through the nasal flu vaccine for children aged 2 to 17. So this is the Fluence Tetra, or the Laiv attenuated influenza vaccine, or we call LAIV for short. So this again is supplied in a box of 10, and it contains single applicators, and they're pre-filled nasal applicators. And each nasal applicator contains 0.2 mils of nasal suspension. It's ready to use. There's no reconstitution or dilution required. And when you look at the vaccine, it's a pale yellow, clear to applacent liquid, and it's a small white particles can appear. Next slide, please. So in terms of the doses for LAIV, you may look at the licensing document. It says that previously unvaccinated children require 2 doses 4 weeks apart. However, there's enough evidence there to say that there's good effectiveness of the vaccine after 1 dose in healthy children. So NIAC actually recommends, contrary to the licensing indications, NIAC recommends 1 dose for healthy children. This is also the same recommendation in UK and Finland as well. They also recommend just 1 dose for healthy children. And as you all know by now, in Ireland, we follow the NIAC advice. So really, most children require only 1 dose, but only in certain cases do children require 2 doses. This is only if the children are medically at risk, aged 2 to 8 years old, and they've never had any flu vaccine before. So it's really, if they meet all 3 criteria, then they require 2 doses 4 weeks apart. I'll repeat that again. So only children aged 2 to 8 who are medically at risk and have never had a flu vaccine before require 2 doses 4 weeks apart. All other children just need a single dose. Next slide, please. So just a quick run through of how you give the intranasal flu vaccine. So the LAIV, so just take out 1 applicator out of the fridge at a time, check the expiry date, remove the nozzle tip protector, and don't remove the nose divider, the dose divider clip. Place the tip of the applicator into the right nostril. The child should be sitting upright. Ask the child to breathe normally. They don't need to sniff it in or inhale it. And next step, please. You just depress the plunger quickly until the divider clip prevents further administration. Then you pinch and remove the divider clip, and then you insert the applicator to the left nostril, and then you again repeat the process, which is depressing the plunger as quickly as possible until all of the vaccine is given. Remember, you need to dispose of the nasal applicator in the sharps bin, and also you need to record the administration of the vaccine. Next step, please. Next slide, please. So just going through the contraindications for the LAIV vaccine. So similar to the QIV vaccine, so if you had anaphylaxis to a previous dose of the flu vaccine or only if its constituents, LAIV is contraindicated. Again, those with severe neutropenia, to avoid an acute vaccine febrile related illness episode, they shouldn't be given the LAIV. This again, doesn't apply to those with primary autoimmune neutropenia. And lastly, again, those on combination checkpoint inhibitors shouldn't receive this vaccine either. Next slide, please. There's further contraindications to the LAIV vaccine, particularly the children with asthma, if they have had an acute exacerbation of symptoms characterized by wheezing, or they required additional bronchodilator treatment in the last 72 hours, or if they have severe asthma and they're on regular oral steroids, or they've had previous ICU or critical care admission for asthma, you should be seeking advice before giving LAIV. Those with severe immunocompromise due to disease or treatment shouldn't be getting the LAIV, and children who live with those who are severely immunosuppressed shouldn't also be receiving LAIV. For example, children who are living with those who've had a stem cell transplant. LAIV shouldn't be given to children who are using aspirin or salicylates, and LAIV shouldn't be given to those who've had influenza antiviral medication in the previous 48 hours. LAIV is also contraindicated in pregnancy. It's contraindicated in those who've had a cochlear implant until the risk of CSF leak has been resolved. It's strongly advised that you consult with the relevant specialist before giving the LAIV if they've had a cochlear implant. And lastly, those with a cranial CSF leak shouldn't receive the LAIV as well. Just remember that if children aged 2 to 17 have a contraindication to LAIV, you can consider giving the QIV, obviously if they have no contraindications to that too. Next slide, please. Just remember, I suppose we did go through a number of contraindications there, but these are not contraindications, which includes asymptomatic HIV infection, children who receive topical or inhaled corticosteroids, children receiving low-dose systemic steroids, and those on replacement therapy corticosteroids, for example, for adrenal insufficiency. These conditions listed here are not contraindications to LAIV. Next slide, please. So just going into the precautions for LAIV, so you should be deferring vaccination until they're recovered from an acute severe febrile illness. Again, talking about the egg allergy, NIAC advises that LAIV has a low ovalbumin content. Therefore, it can be given to children with a confirmed egg allergy or anaphylaxis in a primary care or a school-based setting. The exception to that again is those who require ICU admission for a previous severe anaphylaxis to egg. They should get the LAIV in hospital. Just note that LAIV is the preferred vaccine for children who've had a previous admission to ICU for severe egg anaphylaxis, as the intranasal route is thought to be less likely to cause systemic reactions. And again, it should be given to these children in that cohort in a hospital-based setting. Next slide, please. Remember, in terms of post-vaccination advice, you can, give them paracetamol or ibuprofen for relief from common side effects. But remember to avoid aspirin or salicylate for 4 weeks unless medically indicated. This is due to Ray's syndrome that's been reported after salicylate use during wild-type influenza infection. And also remember to avoid flu antiviral medication for 2 weeks after. You'll also receive the tear pad. That's a picture on the right there. That's to be given to the parents after vaccination, and just gives them some quick advice and information about the vaccine as well. That's also the vaccine record card as well for the child. Next slide, please. Just going on to flu vaccine order and delivery schedule. Hopefully many of you would have already heard through letters that were sent out last week, what we call flu letters. They're also available on our immunisation.ie website. But flu vaccines, as you'll know, can be ordered from the HSC's National Cold Chain Service online ordering system, which is at ordervaccines.ie. And flu vaccine ordering open today. The cycle 1 of deliveries, so deliveries in cycle 1 will be happening between the 19th of September and the 30th of September. That's a 2-week period. During that first cycle of deliveries, you'll only be getting the QIV vaccine, so the injectable flu vaccine, the intramuscularly injectable flu vaccine. And you'll get either of the brands, so you can't specify which brand you'll be getting, so you'll either be getting the one by Sanofi or the one by Mylan. In the second cycle of flu vaccine deliveries, and these will happen between the 3rd of October and the 14th of October, you'll be able to get deliveries of both the nasal flu vaccine and the injectable flu vaccine. And so it's really important that you plan your flu clinics accordingly, and plan your flu clinics once you've gotten confirmation of the delivery as well. Because what we don't want is for patients to be, for flu clinics to be cancelled in terms of for patients and for yourselves as well. And just remember that the flu vaccines will continue to be delivered to the site on a fortnightly basis, so you don't have to order everything in cycle 1 and everything in cycle 2 because you may not have enough fridge space. So just order what you need on a fortnightly basis, and it will be delivered to you. And quantities are done on an equitable basis to make sure that everyone has access to the flu vaccine. So they're based on last year's quantities that you received. And just check your NCCS calendar. It's really important that you check your NCCS calendar to see what the order cutoff deadline is for each cycle, because if you miss that cycle, unfortunately, you'll be waiting a while before your next cycle of flu deliveries. So it's really important that you keep your NCCS calendar at your forefront, I suppose, in terms of during the flu season. Next slide, please. Flu vaccine storage. So once you receive the flu vaccines, they should be kept in a pharmaceutical fridge between 2 and 8 degrees Celsius. You should keep the pre-filled syringes in the outer carton in order to protect from light. Remember, the vaccines are sensitive to heat and cold. In particular, heat speeds up the decline in potency of most vaccines, reducing the shelf life. And remember, never freeze the vaccines. If a vaccine has been frozen, it shouldn't be used because freezing may cause increased reactogenicity, and it may cause a loss of potency for some of the vaccines, and it can also cause hairline cracks in the container, leading to contamination of the contents. So make sure you keep the vaccines at the right temperature in your pharmaceutical fridge. And there's SOPs available on our immunisation.ie website on how to store vaccines, and there's also a HSC land module that it's worthwhile revisiting, even if you've done it before, just to be refreshed on that. Next slide, please. So next we'll be talking about the recommended groups for the flu vaccination program. So as per previous years, all children aged 2 to 17 at the time of vaccination are eligible for the flu vaccine. This year, I know last year we did increase the age group from 65 plus to 50 plus mid-season. But this year we're going back to 65 plus. This policy decision is set by the Department of Health. So again, just a reminder, in terms of the recommended groups for vaccination, is people aged 65 and over this season. Pregnant women, again, are eligible this season, and vaccine can be given at any stage of pregnancy. Healthcare worker, including all GP staff and also all pharmacy staff, are eligible for the free flu vaccine. As are residents in long-term care facilities, carers and household contacts of people at increased medical risk, and people with regular contact with pigs, poultry and waterfowl. And lastly, those aged between 18 to 64 years and 6 to 23 months with underlying health conditions are able to get the free flu vaccine, or are eligible for the flu vaccine. I'm not going to go through the full list there, but this will be available later on for you to review. Next slide, please. Just to kind of some things to note, so only those in those target groups that I mentioned are eligible for the HSC vaccine that you're receiving from the cold chain. So anyone outside those target groups shouldn't be given the HSC vaccine. So anyone who's eligible for the HSC vaccination program, they shouldn't be charged for the vaccine or for the administration costs, even if they don't have a medical or GP card. A reminder about the household contacts and carers. Only household contacts or carers of people who have an underlying chronic health condition or Down syndrome are eligible to receive the free flu vaccine. So, for example, people who are household contacts or carers of people aged 65 and over, pregnant women, of children aged 2 to 17, or of healthcare workers are not eligible to receive the free flu vaccine. It's only the household contacts of those with chronic health conditions or Down syndrome. And remember that a carer is someone who provides ongoing significant level of care to a person who's in need of care in their home due to illness, disability, or frailty. So it's really about that significant level of care. For example, those who receive a carer's allowance. And anyone outside of those groups that I mentioned should receive privately procured stock, and this is a private arrangement. Next slide, please. Just in terms of flu uptake, and just to really quickly, not to go through it too much, if you look at the right-hand side column, particularly children's uptake, we're really concerned about. So in children aged 2 to 17, the uptake was around 17%, particularly low, and it's an area that we'd really like to improve this year. For 65 and over, though, it's worth noting that the flu uptake last season had gone up to 75%, and this is the first time we've ever achieved that 75% target uptake rate that's been set by the WHO. So it's really, something to celebrate, and something we really need to strive to continue to achieve year on year as the HSE. And our providers who are vaccinators as well. And that's because people aged 65 and over are particularly vulnerable, as I mentioned in previous slides. So really keeping that vaccine uptake rate is important this year for those in older adults. Next slide, please. I just wanted to share with you in terms of healthcare worker uptake. So this is one area that we're concerned in. So the HPSC does point prevalence surveys of healthcare sites to ask them about their healthcare worker uptake. And when they did the survey in hospital-based healthcare workers, they noticed a 10% drop in uptake last flu season compared to the previous, a 7% drop compared to the last flu season compared to the previous flu season. So in 2021-2022 season, the uptake in the hospitals was 64%, whereas in the previous year to that, that's the 2020-21 season, it was 71%. Again, a drop in uptake for healthcare workers in long-term residential care facilities. If you notice, for example, the HSC sites last flu season was 55%, but in the previous season to that, it was 66.3%. So almost 11% drop in uptake that you're seeing there compared to the previous season. So again, that's a really concerning trend that we're noticing in the last season that we saw. Next slide, please. So I just wanted to reiterate why it's so important for healthcare workers to be vaccinated this flu season. You know, 3/4 of people with flu have no symptoms, but they can transmit infection. That means healthcare workers can spread infection when they have no symptoms. And healthcare workers are up to 10 times more likely to get flu compared to the general population. And a fifth of healthcare workers are estimated to be infected with flu each season and may continue to work even though they're ill, because they don't realize that they're ill. As I said, you know, a lot of flu is asymptomatic, which increases the risk of spread of flu to their colleagues and to patients. And particularly patients who are hospitalized, studies have estimated that they could be 5 to 35 times more at risk of getting flu if exposed to infected patients or healthcare workers. And institutions with high levels of healthcare worker immunizations across Europe have shown to have reduced rates of flu-like illnesses, reduced hospitalization and death from flu in the older adults, and also a reduction in healthcare worker sick leave as well. So it's really important, if you look at the right-hand side on that slide, everyone in the healthcare setting should be getting a flu vaccine. It includes all frontline staff, it includes general support staff, dental personnel, hospital porters and cleaners, ambulance personnel, carers and home helps, or GP and pharmacy staff and agency staff who fall in the above categories. So it's really important that all of us do our bit to get vaccinated this flu season. And I know everyone in the NIO is going to go to their local pharmacy to get it done. So I'd really encourage you to get it done too. And really talk to your colleagues about it as well, and to understand, if they have any concerns, where they can go to. And there's plenty of opportunities to get the flu vaccine as well. So if you have a peer vaccination program in your local occupational health area, so get that done with your peers. It's a really simple way. They'll catch you on your way to your canteen, so get it done that way. Or you can go to your GP and pharmacy as well. Just let them know you're a healthcare worker, and you can get the free flu vaccine that way. So really encouraging people to get the flu vaccine this season as healthcare workers. We're also doing a little bit of work to understand if there's any barriers for healthcare workers, and thinking about if we can put in place anything to kind of make it easier for healthcare workers this flu season. So next slide, please. The other area, as I mentioned, we really want to improve uptake in is in children. So, and I wanted to iterate, why it's so important that children are vaccinated. And I mentioned about Australia having a particularly high rates, and they noticed that a particularly high rates in children in particular. So, an important lesson for us before the flu season starts. And up to 1 in 10 children under 15 can attend the GP with influenza-like illness. And some of the common complications of flu in children are bronchitis, otitis media, sinusitis, and secondary bacterial pneumonia. And less commonly, you can get serious complications of meningitis and encephalitis, and also primary influenza pneumonia as well. It's worth noting that younger children in particular are at the highest risk, and they're recommended the flu vaccine by the WHO as well. And you'll notice the graph on the right during the 2018-19 season. Children, the age-specific rates that had the highest rates of hospitalization, and children who also had the highest rates of admission to critical care as well. Again, really important to make sure that children get the flu vaccine this season. Next slide, please. Again, if you look at the data from the HBSC over a 10-year period ending in 2018-19, there were around 11,000 notifications of flu in children. There was also just under 5,000 cases of flu-related admissions to hospital, and just around 183 critical care admissions, unfortunately, and really sadly around 41 deaths related to flu as well, noted in that 10-year period. So flu can be a significant impact, and it also has a significant impact on the health and care system as well. So pediatric influenza. Next slide, please. So the aim of the flu vaccination program for children is to protect children in particular, from flu-related morbidity and mortality, making sure that they don't miss out on school, which is particularly important. I think we've seen with the COVID times that they continue to go to school for their mental and physical well-being. And also children in creches and schools are important drivers of the spread of flu. And remember that children can actually transmit flu longer than for adults, so 10 or more days compared to adults who spread it for around an average of 6 days. And children in daycare setting and schools are particularly important transmitters of flu in the community. And you can only imagine why in those settings with younger children, in terms of respiratory hygiene, etc., it does tend to spread quite easily. So the reason why we are vaccinating children is to protect children, but also to reduce the number of people with flu, reduce the number of hospital-related admissions due to flu. It has a wider population level impact on transmission of flu to elderly people, and also those in risk groups, and also transmitting to healthcare workers in families with children. And what we're encouraging you to do this flu season is to engage, if you are a GP or pharmacy, is to engage with schools and other settings where parents are, where children are, to promote or even to offer the flu vaccine in those settings. And we're hopefully going to be releasing fairly soon, actually, releasing resources for GPs and pharmacies to engage with these type of settings, and including consent forms and other things to help you do that and to increase uptake in that cohort. Next slide, please. So I'm not sure, Yvonne, is Lucy here yet?
Yep, I've joined. Sorry about that.
Hi, Lucy.
Apologies for not joining before. So thank you. I can just take you through this one slide around COVID-19 vaccines and the flu vaccine. So we know that lots of people eligible for flu vaccine are actually already eligible for their COVID-19 vaccine booster. So we've already been offering it to people with some long-term conditions and people 50 years and above, and healthcare workers. But NIAC did advise that the flu vaccine can be co-administered with COVID-19 vaccines, and that actually also includes children aged 5 to 11 now. They can happen at the same time on the same day or at any interval before or afterwards. So that's really good news that you can give flu and COVID-19 vaccines together if the person is eligible. So with a COVID-19 vaccine, do remember you have to wait 4 months at least since your last vaccine, and also 4 months since you had any COVID infection. A change for this year is that residents of HICWA registered nursing homes and housebound patients are going to be vaccinated by HSE mobile vaccination teams, and they will offer the flu vaccine regardless of their age, and they will also give them a COVID-19 booster if they need that, and that's starting from the 3rd of October. So more information about that will be provided, and particularly around those who are housebound, if you need to refer into that service, if there will be a referral pathway available for that. You probably have heard that there are some adapted COVID-19 vaccines that have just recently been licensed by the European Medicines Agency. So again, we're waiting for NIAC advice around that. So more information about when those will be used and who they will be used in the programme will be available soon, but we can't speak about that currently today. But what is really important to remember about those adapted vaccines is there are some really important differences between them and the current COVID-19 vaccines. So it's really important before you order them and before you start using them when they come into the programme that you've taken the training that we will make available and that everybody's fully competent to both give them and record them correctly. So that's something that we really want to stress, that when they become available, do please make sure you remember that there are differences between them and you must take training. If you go on to the next slide, please. Alice is going to talk now about the Ict recording system. I see we had a question in around COVID and flu recording, so Alice will take you through the changes we have now. Thanks.
Thank you, Lucy. So this year, the HSE vaccination programme will use the ICT system for COVID-19 vaccinations, COVAX, for capturing immunisation records for flu, as well as for the PPV-23 vaccines. All HSE flu vaccinations, including vaccinations of healthcare workers or patients in all facilities, both HSE and private, must capture these vaccinations on the COVAX system. GP patient management systems are being reconfigured and the HSE PharmaVax and GPVax system updated to enable the COVID-19 flu PPV23 vaccination records from the GP and pharmacies to transmit electronically from their software to COVAX. And if you just look at the diagram on the right there, you will see the way this is happening. COVID-19, flu, and PPV23 payment claims to be sent to the PRS team for reimbursement. The PCRS online portal, which you used to use, will no longer be available for flu or PPV23 vaccinations from the 19th of September of this year. Now, I'm just going to pass you on to Priya Dowling to talk about the available resources for this year's flu program.
Priya, we can't hear you. You need to unmute
Yeah, I think
yourself.
so. Mute maybe.
Can you hear me now?
Yeah, good.
Perfect. Thank you, Alice. With regards to the communications campaign, we're planning to launch in early October alongside our flu awards, which will be taking place again virtually this year. The flu campaign will align overall with the overall HSE winter vaccinations communications campaign. And we'll be targeting our messaging for children aged 2 to 17, at-risk groups, including those who are pregnant, those with certain long-term medical conditions, and people aged 65 and older, and of course, healthcare workers. And we have three main objectives for the communications campaign. The first being to achieve the target uptake for 2022-23, to give everyone who can get the free flu vaccine the information that they need to make an informed decision, and to position the HSE and the NIO as trusted sources of information. This is really important that we're seen as the go-to information source for vaccines and flu vaccines. In terms of resources that are available for vaccinators, if you visit hsc.ie/flu, you can download information leaflets, posters, videos, there's FAQs, algorithms, and also administration guides. For information specifically for healthcare professionals, that's available on our website, immunisation.ie, or on the direct link on the slides. We have programs on HSC Land, e-learning training programs, 2 of which are for Laiv, the children's flu vaccine, and 1 for QIV. We've also recently developed a new training program for the pneumococcal vaccine, PPV23. You can find these courses by going on to hscland.ie and navigating to the course catalogue, clicking on clinical skills, the National Immunisation Office, and for the flu e-learning program specifically in the Influenza Flu Vaccination folder. For inquiries, you can email us at immunisation@hsc.ie, and please note that we only respond to queries from healthcare professionals. The Ict Chapter 11 is also available on the NIO website at immunisation.ie, and you can find patient information leaflet and the summary of product characteristics for each of the vaccines on the HPRA website too. I'm now going to pass you on to Muthu, who will discuss the frequently asked questions that we get from healthcare professionals.
We can't hear you, Muthu. You need to unmute yourself.
Can you hear me now?
Yes, we can.
Thanks, Priya. I'm just going through a few FAQ, frequently asked questions from the healthcare professionals based on the queries you are receiving in the immunization inbox. Is first about the co-administration. Co-administration of flu vaccines and other vaccines can be given at the same time or at any interval, even children 5 to 11 years as well. However, it is not known if a COVID vaccine reactogenicity is increased when you are giving together. So the vaccine should be preferably given in the different limbs. At least you can monitor if there is any local reactions. So the next one is the LAV can be given at the same time or at any time before or after any other live or non-live vaccines, including like MMR or varicella. I'm talking about the LAIV, the nasal spray, can be given with either non-live or live vaccines. Except there is one exclusion, the PCV 13 for children aged 12 to 23 months should be separated at least a week because there is a risk of febrile episode. Next slide, please. Co-administration of PPV-23, pneumococcal polysaccharide vaccine 23. PPV-23 vaccine may be given at the same time when the flu vaccine is given. PPV vaccine is only needed once at the age of 65 years or over, regardless of any other risk factors. There are some high-risk medical risk category people. They need PPV under the age of 65. There is a new HSC land module is developed recently by the NIO. Would you please visit the HSC land and go through the PPV-23 module? There is a new algorithm who will be eligible for the PPV-23 first dose, who will be eligible for the booster dose, who are all the high-risk medical conditions, group A, as per the NIAC recommendation. The whole algorithm will be available in the NIO website shortly, but the HSC land program is available at the moment, so you can access the program. Next slide, please. The expiry date for LAIV is not like the other flu vaccines. The LAIV, the nasal spray vaccine for children, it's very shorter lifespan. It has only 18 weeks from the date of manufacturing. The expiry date is written on the side of the nasal applicator. Just make sure you check the day, month, and the year. It's not only the month, you have to check the day as well. The expiry date may not necessarily be the last day of the month. So please check the day, month, and the year of the expiry date before you give the vaccine to the children. Next slide, please. LAIV, what to do if in case if you are giving the vaccine and the child suddenly sneezes or the nose drips. The vaccine doesn't need to be repeated. So the LAIV, it absorbs very quickly after the administration, and there is a surplus of attenuated virus particles in the vaccine that needed to boost the immunity. So there is no need to repeat the vaccine or the dose if the child sneezes or the nose drips. If the LAIV given in the only one nostril, the whole vaccine is given, that means there's no need to repeat the dose again. A 0.1 ml dose given into one nostril, which contains enough, again, the attenuated viral particles to induce the immune response. So there is no need to repeat the dose. If all the vaccine, if given to the same nostril, still there is no need to repeat the dose. That is sufficient to cover the child for the flu season. Next slide, please. What are the vaccines recommended by the age group? For this flu season, for 2020 to 23 flu season, the Qiv, the Quadrivalent live attenuated influenza vaccine, the LAIV vaccine, the nasal spray, is for those aged 2 to 17 years. The brand available is called Fluence Tetra nasal spray. It's manufactured by AstraZeneca. It's given through the nasal spray, nasal applicator, using the nasal applicator. And the inactivated Qiv is called the inactivated quadrivalent influenza vaccine. It is available for all other eligible populations, including those aged 2 to 17 years, if there is a contraindication to give the LAIV. So the Qiv basically licensed for those aged from 6 months and older. There are two brands of available injectable Qiv in Ireland. The both are interchangeable if there is a case if 2 doses are required. For example, there is a medically risk group like who have the cancer, post stem cell transplant. If they need 2 doses of vaccine Qiv, they both are interchangeable. What are the two brands? Already, I think Aparna discussed about that. So one is Qiv split variant inactivated. It's manufactured by Sanofi Pasteur. The other one called Influenza Tetra, manufactured by Mylan. There is no AQAV for this season for older adults who are aged 65 and older. And there was a AQAV last season. For this season, there is no AQAV. It's only 2 brands of QAV injectable vaccines are available for this season. Next slide, please. In some queries about the egg allergy, NIAC always recommends if those with the confirmed egg anaphylaxis or egg allergy can be given influenza vaccine in a primary care or school setting, with the exception who have required admission to the ICU for a previous severe anaphylaxis to egg. If anybody got the admission in ICU, end up in ICU due to the egg anaphylaxis, they should not receive the dose in the primary setting. They should receive in the hospital settings. LAIV is the preferred vaccine for children who have admission to ICU for a previous severe anaphylaxis to egg, as the international route is less likely to cause systemic reactions, so it should be given in the hospital. Those need non-live influenza vaccine who have had a previous ICU admission for a severe anaphylaxis to egg should be referred for specialist assessment with regard to vaccine administration in the hospital. So basically, if somebody got egg anaphylaxis and they end up in the ICU, they should receive the vaccine in the hospital setting. They should not receive in the community setting. Otherwise, the rest of them can receive in the school setting, or sorry, in the community setting. Next slide, please. Adverse reactions for LAIV, the nasal spray. The local nasal congestion is very common. The general one, they normally get the body ache, decreased appetite, headache, myalgia, and fever are more common. Fever is no more frequent than the following other recommended childhood vaccines. Is mainly mild and resolves in a few days' time. There are very rare immediate allergic reactions reported. Note that is there are very rare reports of GBS, Guillain-Barré syndrome, have been observed in the post-marketing setting following giving the QAV, the injectable vaccine. However, the risk of GBS is far greater following the flu illness rather than receiving the vaccination. That means if you weigh the risk versus benefit, the benefit is so higher than the than getting the flu illness. So it's better to take the vaccine. Please check the SMPC for the vaccines. You can get more details about this. Next slide, please. Non-live QAV, that's an injectable vaccine. The local reaction could be injection site pain. Sometimes there's a swelling, as are very common. The general common symptoms: fever, fatigue, myalgia, and sometimes the irritability in young children are very common. Drowsiness, sweating, and arthralgia are common side effects. Very rare, there is immediate allergy reactions. Again, very rare reports of GBS have been observed in the post-marketing setting following the QAV. So again, the getting vaccine, GBS from getting vaccines far lower comparing with getting GBS after the flu illness. So it is highly recommended to take the vaccine. Please check the SMPC for QAV. The remainder, this is about the post-vaccine observation. Vaccine recipients should be observed for at least 15 minutes after vaccination. If this is not practicable, vaccine recipients should at least wait in the vicinity for 15 minutes. The availability of protocols, that means medicine protocol, the equipment for anaphylaxis management, the anaphylaxis kit, and the drugs necessary in the kit for managing the anaphylaxis should be checked before a vaccination session, like adrenaline, epinephrine to be checked, the date and all those things, and the syringe and the rest of the equipment should be checked before you set up the clinic. Post-vaccination advice on possible adverse reaction. Any side effect should be reported to the HPRA. It takes around 2 weeks after vaccination to get the protection against the flu. You should inform the recipient. It will take at least 2 weeks to get the protection against the flu. So that means they still have to follow the public health advice. There's a chance they may still get the flu as well. Next slide, please. And now I can hand over to the NAO panel for any questions.
Thank you very much, panelists, for all your help answering the questions so far in the chat box. Maybe if I just summarize some of the key questions that are coming up and we can go through those, if that's okay. So I suppose one of the questions that came up was, how long do I need to take it out of the fridge to come up to new room temperature? Remember that the flu vaccines come in pre-filled syringes and they're really small liquids in terms of 0.5 mils, 0.2 mils. It's a really small amount of liquids. Just a couple of minutes outside the fridge, they will come up to room temperature. I wouldn't leave them out of the fridge for much longer than that, because they should be stored at 2 to 8 degrees. But really, it's just that, take it out of the fridge, while you're preparing all the paperwork, it will come up to room temperature. So being really pragmatic about that, I think, is important. I think someone else asked about if there's an older adult, for example, who's eligible for the COVID booster, who requires a flu vaccine, and who's also never received a pneumococcal vaccine, PPV23 vaccine, before age 65 and over. They can get all 3 vaccines at the same appointment. There's no problem with that. Just as Mutu was saying earlier on, make sure you leave some space between the vaccines, because it may be a bit sore for the patient. So for patients' comfort, really use different limbs for that, and at least leave some space between the vaccine administration sites as well within that, again, for patient comfort. And I think there were some questions about the operational aspects of it. As I mentioned, we did go into a little bit about the operational aspect of it, very much similar to the previous years. The only change in terms of operational bits is that HICWA registered nursing homes and housebound patients will be visited by the HSE COVID-19 mobile vaccination team. So they'll be going to those settings to offer the flu vaccine to those residents in those HICWA registered nursing homes and housebound. If you're confused, or if you're not sure about your local area, talk to your flu lead. There's a flu lead in each of the CHO areas. Talk to them about, if your site is getting the flu vaccine or not. And there's just a quick things I wanted to pick up and clarify, really. So when we talk about patient information leaflets, so there's the HSE patient information leaflets that you can find on our hse.ie/flu website. There's also manufacturer patient information leaflets. So these are produced by the manufacturers, and those are found on the HPRA website. We tend to, in our HSE information leaflets, tend to be quite generic, and also give a lot of frequently answered questions for the patients. But you can also give the patients, in addition to the HSE leaflet, the manufacturer leaflet as well. Just a quick reminder to everyone, I think the 15-minute monitoring post-vaccination, important that that's adhered to, because I know for COVID-19 vaccinations that was temporarily removed, but for this season it's important to remember that that's been reintroduced. So for both COVID and flu vaccinations, that 15-minute post-monitoring advice, as Mutu was saying, is important that it's put back into place as well. Just a quick reminder in terms of the ICT side of things. Alice went through it in quite a lot of detail. I know the picture was a little bit small on the slide. I'm sorry about that, but you'll hopefully be able to kind of go into this recording and have a look at it in a bit more detail. But essentially, we're just enable co-administration of flu and COVID. What we've done this flu season is we'll be using COVAX, and if you have access to COVAX, you'll be recording flu vaccinations on that. What we've also done is to make it much easier for GPs and pharmacists. You'll be using the same system as COVID-19 for recording the flu vaccine as well, and also the PPV23. So you'll be using your practice management systems if you're a GP, or GP Vax. If you're a pharmacist, you'll be using the PharmaVax. And the beauty of that system is the data from that is recorded and captured automatically and sent to both COVAX and also to the PCRS system. So you don't need to enter into the PCRS system, which is great because it saves you time and you're able to spend more time with the patient. The PCRS portal will be closing for flu and pneumococcal vaccines from the 19th of September to make sure there's no double systems going there. I know pharmacists, there is a bit of a particular need as well, that you're supposed to be reporting privately administered flu and pneumococcal vaccines. And so that again will be captured through your PharmaVax system. So you won't be using the PCRS portal for private flu and pneumococcal vaccines as well. Just remember that only GPs are part of the pneumococcal vaccination program. So only their data will be going and be processed to be sent to the PCRS system through the GP practice management systems and also GP Vax. So again, you won't be using the PCRS portal for that. Hopefully that's made it a bit clearer in terms of some of the frequently asked questions and some of the questions that are coming up in the chat. I'm sorry if we haven't got through to everything, because there's lots of questions coming in, and our panelists, I see, have been busy trying to put everything into the chat, replying to you as they come up. If we've missed anything, what we'll do is we'll be downloading the chat and looking at the commonly asked questions, and we'll be adding that to our FAQs on immunisation.ie, which is our healthcare provider area, which has all of the various materials you may wish to look at for the flu season. So the FAQs will be added to that as we go on through the flu season, especially as we receive those. So just handing over to Lucy for any closing remarks. Thanks, Lucy.
Oh, hi. Yes, I was just answering another question from somebody. So yes, do keep ask immunisation.ie if you have any other questions. Thank you so much for so many people joining us, over 300 people. So that was brilliant, and I do hope everybody learned something and has at least been pointed in the direction of material so that everyone can have a successful flu vaccine programme. And thanks very much for the interaction and for everybody taking part. That was really helpful.